Hi, I'm Dr. Sanjay Panicker. I founded Amrita Homeopathy in 1996 in a small town in Kerala. We have two clinics now in Bangalore. One is in Korumangala and the other one in Marathali. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics, infertility, varicocele and hepatitis B. In children, usually if we find allergies, we must understand that there is a genetic predisposition for it. Not necessarily the same type of allergy has to be there in the parents. It can be from anywhere in the family tree. That a tendency for an allergy has passed through the generations. Allergy in the sense an oversensitive immune system. Like an oversensitive immune system can react to dust particles in the respiratory tract or in the skin in contact allergens, or it can be an oversensitivity to certain things in the food. This is all classified as allergy itself. So when we find that the patient's father, for example, or a mother, or maybe grandparents, or somebody has a tendency for a skin problem, which is an allergic issue, the subsequent generation can develop something which is a respiratory allergy. They may seem not very much connected because one is in the skin, the other is in the respiratory tract. But essentially, both these things are related with the immune system. If the immune system is corrected, both these issues can be tackled. So basically, all allergies stem from a genetic predisposition which is inherited across generations. So that is how in children allergies may come up. And whenever they come in contact with something which their body has become sensitive to, then that memory is registered that this is a bacteria, or this is an unwanted thing, or this is a foreign body. The immune system registers it. Next time it comes in contact with it, the reaction can be a little more severe. For example, if you are in contact with dust and you develop sneezing, the next time you are contacting with dust, it may become a little more severe, and the third time it can start affecting your throat. And then over several attacks like that, sensitivity can increase and you can start becoming prone for even breathing problems and respiratory issues of the lungs, involving the lungs. So the disease has actually progressed from the upper respiratory tract to the lower respiratory tract. The sensitivity has kept increasing. So that is how a patient can progress from one stage to the other. Usually when allergies progress, initial phase, we find that many patients present with atopy or allergy in the skin, where they developed complaints like diaper rash, they develop complaints like rashes in the elbows, fold of the neck, fold of the knees, around the mouth, perioral it is called, and periorbital around the eyes. So these are all allergic indications that the child is probably prone for allergies. So when you find these kind of symptoms, rashes, very often we find infants with rashes on the cheeks, that is called as infantile eczema. When you find that, you know that this child is probably heading towards an allergy and has a tendency towards it. So treatment in that early stage itself helps the patient or the child from going into the subsequent stages. Usually as the disease progresses, it progresses from the skin to the respiratory tract, so from the upper respiratory to the lower respiratory tract, and that's how it progresses.